in.
Hi, is this Mr. Hickey?
Yes, it is.
Hi, I'm Julia Daniel. I'm a second-year medical student. I'm going to take care of your musculoskeletal exam today. Is that okay with you?
Yes, that's fine.
Okay, so I'm going to wash my hands really quickly, and I'm going to ask you to go ahead and just drape yourself.
Okay.
That's okay. All right, wonderful. And so first what we're going to do is I'm just going to look at a general observation of the patient. He seems to be aware and alert and is not in any distress or discomfort. He's not holding any of his limbs in pain, so that's good. And so now we're going to move on to the shoulder. So first I'm going to look at the shoulder from the front. I'm looking at them simultaneously, looking for the symmetry of the shoulders, if there's swelling, if there's any masses or signs of infection on the shoulders. And then I'm going to run to the back. And I'm going to also assess those things at the back, looking again for symmetry, swelling, abnormal, things like that, signs of infection. And then I'm going to look at the scapula as well, make sure that it is in line with the back and that it's not winging out or anything crazy like that. So then, if it's okay with you, we're gonna just feel around a little bit on your shoulder.
Okay.
Okay, so first we're looking for the sternoclavicular, and we're just gonna palpate that down until we come to the acromioclavicular. We're gonna feel on that, and we're gonna feel for the glenohumeral point as well as the biceps tendon attachment. And then during that, I'm assessing for tenderness, pain, crepitus, or warmth. Is there any pain in any of those symptoms?
No.
So now what I'm gonna ask the patient is we're going to do some active range of motion, moving our limbs around a little bit. And so we're gonna do that first for the shoulder. So what I'm gonna ask you to do is just repeat after me.
Okay.
So I'd like for you to go up with your shoulders, adducting, and then abducting, and then adducting, coming back down. Wonderful. And then I'd like for you to come out for external, and then come in and give a hug for internal rotation. And then last, I'd like for you to come in with your shoulders and come up for flexion and out for extension. And then during that time, again, we're gonna ask the patient if there's any tenderness or pain. Was there any pain?
No.
Okay, good deal. So now what we're gonna do is look at the elbow, if you don't mind standing up for me really quickly, and just standing naturally with your arms out like that. We're looking at the carrying angle and looking at symmetry along the elbows and seeing again for the swelling, the change in size, signs of infection, abnormalities. Okay, you can go ahead and take a seat.
Okay.
So once there, we're going to look at certain areas of the elbow. We're going to look at the lateral and medial epicondyles, the antecubital fossa, take a look at that, and then come up for me, please, if you don't mind. And then we're going to look at the olecranon and look at that. Thank you, you can rest. So now, if you don't mind, I'm going to feel around on your elbow.
Okay.
So again, we're going to feel at the lateral epicondyle and the medial epicondyle. We're then going to feel at the antecubital fossa, and then if you'll come inward, wonderful. Then we're also going to feel on the olecranon, and we're going to feel for any tenderness, pain, swelling. Is there any pain there?
No.
Okay. So then, with the patient's permission, we're going to do some active motion of the elbow, if that's okay with you.
That's good.
Okay, so just repeat after me. We're going to come up with flexion.
Okay.
We're going to go out with extension, and then we're going to protonate and supinate our elbow. Is there any pain within that exam?
No.
Okay, good deal. So now, since we've done the elbow, we're going to move down to the wrist and the hand. So we're going to ask the patient to hold out both of his hands and let me just look at them, at the symmetry with their swelling, signs of infection, abnormalities, anything like that. And we're going to flip our hands, and we're going to look again for those things on the dorsum of the hands, swelling, abnormalities, signs of infection, things of that nature. You can go ahead and take a rest. From there, we're going to palpate some areas on the wrist, if that's okay with you.
That's good.
Okay, so we're going to first palpate the wrist, and then once we palpate the wrist, we're going to palpate the metacarpal bones, as well as the metacarpal joints and the phalanges. Was there any pain within that?
No.
We're looking for crepitus, warmth, swelling, and I didn't feel any of that within that exam. So now, with your permission, we're going to do some range of motion with your wrists and hands.
Okay.
Okay, so if you'll just follow after me, we're going to take our wrist, we're going to go up with flexion, out with extension. We're going to ulnar deviate and radial deviate, and then we're going to protonate and supinate. Was there any pain within that exam?
No.
All right, lastly, we're gonna do some of the active motion with your hands. We're gonna go out or up with flexion. We're gonna go out with extension. We're going to abduct, adduct, and then we're gonna opposition with your fingers. Was there any pain within that exam?
No.
Okay, again, we're looking for any pain within that exam, and this patient did not have any pain with this exam, so because of that, we're going to, in the encounter, I'm going to redress you. I'm gonna go talk with my team, we'll get back to you.
Okay, thank you.
Okay.